హాయ్, వెల్కమ్ టు కేర్ సంవాద్ విత్ మీ మిర్చి హేమంత్. ఈరోజు నాతో పాటు ఉన్నారు డాక్టర్ గురు ప్రసాద్ సార్. వెల్కమ్ టు ది షో.
థ్యాంక్ యూ.
లైక్ యూ సైడ్, మాకు ఒక బండిల్ ఆఫ్ క్వశ్చన్స్ ఉన్నాయి సార్, దట్ వీ వాంట్ టు లైక్ త్రో ఎట్ యూ. ప్లీజ్ పేషెంట్గా అన్ని ఆన్సర్ చేయాలి మీరు.
షూర్ షూట్ ఎట్ మీ.
సార్, ఫస్ట్ థింగ్ ఈజ్, నాకు చాలాసార్లు లైఫ్ స్టైల్ గురించి చాలామంది చెప్తూ ఉంటారు కదా సార్. అసలు లాంగ్ టర్మ్లో అంటే రెస్ట్ ఆఫ్ ద లైఫ్లో మనం కాస్త హెల్తీగా హ్యాపీగా ఉండాలి అంటే ఎర్లీ లైఫ్లో ఎలాంటి లైఫ్ స్టైల్ ప్యాటర్న్స్ సెట్ చేయడం, ఫాలో చేయడం కరెక్ట్ అంటారు?
So actually, very interesting question you asked, because WHO realized this thing, and in 2025 they have a campaign running, which is healthy beginnings and hopeful futures. So what they mean to say is ki mana actually how our health is depends a lot on when we are in our mother's womb. So if the mothers actually are told about healthy lifestyle, and we have a very kind of a normal pregnancy where nutrition is taken care of, stress free, and proper antenatal care untunde. So that way the children are born healthy. So mothers' mortality rate reduces, children are more healthier, and they turn out to be healthier in the future. So this I'm talking about is like primordial prevention antam. Ante entante inka birth munde you're taking some preventive strategies. But I think actually a lot of us have been born recently, and people who are hearing right now are also been born on earth for the past, I think, 20-25 years. So వాళ్ళకి ఏంటంటే what we tend to tell is that even if you are now still late onto the bus, it's never too late. In fact, you can lead a healthy lifestyle. Healthy lifestyle అంటే ఏంటి బేసిక్గా అంటే, you said happy. One is happiness is what we try to seek. Other is happiness is inside. You be happy from inside. So if you are happy from inside, and then you take a conscious effort to take care of your health in whatever ways you can, whatever is financially viable for you. Do not go for hi-fi tests or simple things like simple healthy eating, sleeping properly, doing adequate exercise, fresh air, sunlight. I think these are more than enough for us to be actually healthy.
రైట్. అండ్ ఆల్సో సార్, ఈ ఎర్లీ ఇన్ లైఫ్లో ఎలాంటి ప్రివెంటివ్ హెల్త్ మెజర్స్ తీసుకోవాలంటారు?
I think one epidemic which is going on right now is actually screen time. Okay, now the other day I was in a restaurant and I saw a child crying, and mother was too impatient to actually quieten him. The next easiest thing was to give a phone to him, and the child is hooked onto the screen. So what happens is that this becomes like a habit. It might be something what we nowadays call as a dopamine fix. Seeing the screen actually gives a lot of dopamine high inside us, and that you are inculcating at a very young age in the child. And so once they get addicted to the screen, physical activity comes down. I mean, they don't want to go out, because playing again means making an effort. That same dopamine fix they're getting with the screen. So the concept of going out, playing out in the open fresh air is going away. So as you said, I think as parents we need to train our children to maybe have limit screen time, tell them to go out. Also social interaction comes down. I mean, people who are addicted to screen, they don't talk to their peers. So the way they are supposed to interact with their peers is also going away. Why I'm telling you all these things is because health is not only about physical health, it's also about mental health. So people who do not know how to interact with their peers are also not mentally okay, or their mental health is not okay. Because then they become loners and they become self-centered. So giving, sharing, all these concepts don't exist for them. So that way we are creating a society which is becoming into itself. It is like more and more preoccupied with itself. So we're not having healthy people. Healthy not only physical wise, but also mentally. So this, I think we need to change that perception about how we are looking at things.
ఆల్సో సార్, ఈ లాంగ్ టర్మ్ హెల్త్ కి సంబంధించి ఫ్యామిలీ హిస్టరీ అనేది ఎర్లీ లైఫ్ అసలు ఎంత డిపెండెంట్గా ఉంటుంది?
So I mean, as you said, there are some diseases which have got a linear relationship with family history. Let's say diabetes, especially type 1 diabetes. Type 1, type 2 రెండు ఉంటాయి diabetes. Type 1 is where you are dependent on insulin, and type 2 is where you make amount of insulin, but later on in life it's basically tablets which you are dependent on initially. So type 1 diabetes lo chala linear ga untundi family history. If it is there, the family history is there, you probably will end up with type 1 diabetes. But diabetes or hypertension are also multifactorial. They are not purely genetic. Ante family history unte it places you at, let's say, a little more risk than the average individual. But having said that, other factors come into play. Like you have a family history means that మీకు ఒక లేబుల్ ఉంది, యూ ఆర్ ప్రోన్ టు గెట్ డయాబెటీస్ అనే. They only say prone to get. They're not saying you will get. So you make that prone to get to you will get by the kind of lifestyle you are leading. If you are eating unhealthy, there is no proper exercise, stress, unreal targets, expectations. So all those things combine to form a deadly concoction or combination where you will land up with lifestyle disorders like diabetes, hypertension. So a family history doesn't label you that you're going to get it or you are unlucky, because genetics you can't change, right? But what you can change is your level of risk of getting those diseases. That is in our hands.
Correct. And at the same time, sir, daily routine లో జనరల్ గా మేమందరం చేసే కామన్ హెల్త్ మిస్టేక్స్ ఏంటి?
Unreal expectations for ourselves, taking stress.
Okay.
Is one common mistake everyone makes. Okay. We know that it may be unreal. We know it is going to harm us, but still we tend to go towards it. So, I mean, that's a mistake which everyone consciously and unconsciously makes, even if that insight is there, that this is not achievable, we try to strive for it. No, I want to be like Mukesh Ambani, where in an hour I'm earning like crores and crores of rupees. But I don't get it, I get stressed about it. Why am I not able to do it? That's unreal expectation. That's putting unnecessary stress on me. I have a real expectation. For example, today I'm talking to you, I don't want to make a fool of myself. That's a real expectation, right? So I come little prepared for that.
అగైన్ సార్ ఐ మీన్ అసలు చాలా మంది ఈ స్ట్రెస్ ఎట్లా హ్యాండిల్ చేయాలి, లేకపోతే లైఫ్ స్టైల్ ఎట్లా సెట్ రైట్ చేయాలి అంటుంటారు. మీరు యాజ్ అ డాక్టర్ టూ బిగ్గెస్ట్ అడ్వైసే మౌంటైన్స్ దట్ వీ హ్యావ్ ఇన్ అవర్ లైఫ్ విచ్ ఇస్ హ్యాండ్లింగ్ స్ట్రెస్ అండ్ సెట్టింగ్ లైఫ్ స్టైల్ రైట్. ఎలా చేయాలంటారు?
Honestly, I never thought about it that much. It was more like I don't say I'm not stressed. Obviously, when you have a sick patient, it is stressful for you because there's so many expectations from the relatives in keeping the patient alive. The additional stress nowadays of getting beaten up. Okay, that's a different thing. But yeah.
Sir, your sense of humor does not let you have stress, sir.
So that's the additional stress. But yeah, it's a conscious effort we make to not to be stressed. For that, you need to have an avenue to let that stress out. So let's suppose I'm in the hospital, and for anyone who is working, I think if you are stressed at that place, there's no way you can escape that stress because that's going to be there. So if you make more effort to come out of that stress, you are actually more stressed trying to come out of that stress. So there has to be an avenue, some hobby or something which lets you let that steam out. It can be maybe reading a book or listening to music or catching up with friends, having a cup of tea. So that acts as stress buster. So this thing is that if you can't avoid stress, going into Hyderabad in this traffic is a stress by itself. But you can't avoid it. It is the part of our life. But then you should have an avenue where you let out that stress. Whichever way, that's a choice, or that's a personal choice which we need to make. And that's I think that's how we all cope up.
Correct.
That's how we want to cope up. I have my own stress busters.
Yeah.
That's how I cope up with it.
And lifestyle? How to set it right?
Lifestyle set it right, and it has to first of all you have to first understand you have something wrong. Unless you know you're something wrong, you will not try to set it right.
Clearly, yes, sir. But eating is wrong, sleeping is wrong.
Yeah.
Meeta aithe chappakaraladu asalu.
So try sitting in my OPD for one day, and you'll understand. People think what you're doing is right, and there, for example, there's a lady who walked in today. Obviously, because of various reasons, I cannot tell the name, but she said your medicine are not working. She just threw the book at me and she said your medicine are not working. Then I asked her okay, fine, you're not taking my medicine not working, but what else are you doing? Then the son comes out and saying she has polished off all the crate of mangoes which came this season. Then what do I say to her? It's
like really not her fault, mango's fault.
Yeah, fine, mango's fault, but then it's also not my medicine's fault that they're not working. So I mean, there are people who feel that they're doing everything right, but it may not necessarily be that. They're probably doing something wrong. And then if you know that awareness that they're doing something wrong, then you'll set something right.
Correct.
So first is the awareness that, okay, something is going wrong with the way I'm living. Maybe you are kind of spending a lot of time on your screen. There's no family time. So people say, nowadays we are, even though we are close, because of the digital devices, we are actually far away.
Correct.
Because each one is into their own, whole world.
True.
So there is closeness in terms of physicality, but distance in terms of, you know, the mental connection.
Correct.
So, I mean, that's where, and unless we bridge that gap, I don't think we're going to find happiness anywhere.
సార్ మీరు చెప్పే గట్టి గుచ్చుకుంటున్నాయి సార్, ముందే చెప్తున్నాను మీకు.
Okay, it should.
సో సార్ మీరు స్ట్రెస్ చెప్పారు, లైఫ్ స్టైల్ చెప్పారు, ఫుడ్ చెప్పారు, స్లీప్ చెప్పారు, కానీ అన్నిటికంటే ఇంపార్టెంట్ థింగ్ ఈ మధ్య కాలంలో నేను వింటున్నది గట్ హెల్త్ అని.
Yeah.
అసలు ఓవరాల్ వెల్ బీయింగ్ లో గట్ హెల్త్ అనేది ఎలాంటి రోల్ ప్లే చేస్తుంది?
And gut health actually, we have come in, I think we come a full circle in gut health because our ancestors knew about gut health. They had foods which actually promoted good gut health, like, you know, we call it sadhanam. We used to eat that. Our grandparents used to eat that for breakfast. Then we just went on to our own tangent about now saying, okay, gut health is all bullshit. But then we have started relating gut health to a lot of things, you know, especially mental health. Then a lot of autoimmune diseases are related to gut health. In fact, they're saying everything is about gut health nowadays because the gut is the second brain. And there's an interplay between the gut neurons and your actual brain. The gut is not healthy, you're not happy. So there's a lot of connection going on. Gut microbiome, we're talking about. Microbiome ante, basically gut is what? It's a reservoir for a lot of bacteria. They stay there, they live there. And in fact, you'll be surprised to know that the number of bacteria there are more than the number of cells in our body.
Oh.
It's almost like a second population going there. It's an alien planet there actually going on. So there's an interplay between them. They keep talking to each other. You know, they say, okay, fine, no, hey, this gut is not healthy, you know, for us to say it. We're not happy here. So the gut bacteria are depressed, you are depressed. So it's as simple as that.
Wow.
Yeah.
Sir, early signs of gut ill health enti?
People come with, you know, I don't feel good, I feel bloated after eating food, you know, I don't feel good about it. Or the moment I eat food, I feel full, I can't digest. People come with constipation, you know, improper bowel evacuation or diarrhea.
Or more number of times.
Yeah, diarrhea or constipation. The commonest is actually, in India it is constipation actually, honestly. It's not diarrhea. Diarrhea predominant IBS, irritable bowel syndrome antamo. It's little, it's not seen too much. Constipation becomes the more prominent feature among Indians. And somehow Indians never can empty their bowel completely, satisfactorily. Most of them come with, I'm not able to empty my bowel unless they take a huge dump, they're not really happy about things. So, but having said that, it's a very oxymoron because the fact that we eat a lot of fiber as Indians.
Correct.
Yeah, we do eat a lot of fiber. Americans actually eat very less amount of fiber. Correct. They eat a lot of red meat. Yeah, this thing of gut health, that the first symptom to come up is like you're indigested, bloated, you can't tolerate certain food items. That is, I think, one of the first symptoms.
అండ్ అలాగే సార్ ఈ ప్రీబయోటిక్స్ ప్రోబయోటిక్స్ అంటుంటారు కదా, ఈ మధ్యన అయితే చిన్న చిన్న బాటిల్ కూడా అమ్మేస్తారు పిల్లలకి. అసలు దీని రోల్ ఎంత ఇంపార్టెంట్?
సో ప్రీబయోటిక్ అంటే ఆర్ ఫుడ్ స్టఫ్స్ విచ్ ప్రమోట్ the gut bacteria to be happy.
Correct.
So I mean in India, onions, garlic, these are all prebiotics actually, and this promote the environment in the gut for the good bacteria to proliferate. Probiotic is the good bacteria. I mean, there is there's one brand called, I think, Yakult, if I'm not mistaken.
Correct.
They market it as.
చిన్నపిల్లలందరూ తాగేస్తుంటారు.
Yeah, but again, there's a lot of sugar in that, by the way. That's why they like it.
That's why, correct.
Yeah, so it's like a sugar drink, and it's really unhealthy to drink that much of sugar, you know. So, in fact, I mean, there are people who I know of one of my friends who gives his child Yakult on a daily basis in the night, and the child forgets to brush his teeth after that. So there's a lot of caries in his teeth. So the sugar actually causes a lot of, the problem starts with the mouth then, no?
Yeah.
Down to the gut.
Yeah.
So they're not really healthy to take. I think we have a lot of enough, your curd is enough probiotic for you.
Correct.
For a day, honestly speaking. Why do you need to take another extra probiotic from anywhere?
సార్ మనం అసలు ఓవరాల్గా సార్ మన హెల్త్కి సంబంధించి మనం కామన్గా ఇగ్నోర్ చేసి, అంటే ఈ హెల్త్ సీరియస్ ఇల్నెసెస్ కూడా చాలా ఇగ్నోర్ చేస్తుంటావు కదా, ఎలాంటివి వాట్ కైండ్, లైక్ గివ్ us some examples?
అంటే ignoring అంటే people just brush away some warning symptoms, you know. For example, let's say, as I said, some person is having a cough. People just think, brush it away, it's allergy, probably Hyderabad pollution which is going on, you know. 2 weeks, 3 weeks into it, and then we see there's something else going on. It might be simple thing like an allergic bronchitis or like, you know, some allergy to a more serious issue. But people have a habit of procrastinating their health, and I'll get to it why it is so, because unhealthiness is something which people don't want, they're not seeking, And for them, spending money on that is something which they really didn't want to do, but they're forced to do. Same person, if he wants to go to a cinema hall and spend 400 rupees on the popcorn, he will do it because it's giving him pleasure. But spending on his health is not giving him pleasure. It's actually a job to finish off. So that's why there's a problem in the perception of people in spending for health versus spending for pleasure. So because they are deriving pleasure out of it. Here they are not deriving the pleasure. Just you come to a doctor like me and you'll say 10 more things, write 10 more tests and say, okay, fine, I need to spend more money on this fellow's consultation, then on the labs, then on the medicines. I'm just keeping on spending money. There's no end to it. But eventually the crown at the top of it is people don't realize that, which is health.
కరెక్ట్ సార్. అసలు నాకు మాట చెప్పండి, మేము హెల్త్ బెటర్ చేసుకోవాలంటే మేము ఈ రోజు లైక్ నా టుడే చేయాల్సిన ఒక్క లైఫ్ స్టైల్ చేంజ్ చెప్పండి.
One lifestyle change, single lifestyle change. Go on a digital detox.
ఇంకోటి వేరే.
One more thing, I mean, designate one day in a week where you eat really healthy.
One full day?
One full day.
ఇంకోటి.
Then it's like sleep properly.
This full day I can sleep.
No. That is also right. Excess of anything, I told you in the first part of my interview that excess of anything is bad. You should not do that.
So which is starts with digital detox?
Yeah.
Healthy food?
Yeah.
And sleep well.
There's a concept called 21-90, right?
Yeah, 21 days you do
something, no? Then it becomes a habit.
Yeah.
90 days it actually becomes a part of your lifestyle.
Correct.
So if you can do something, probably for 21 days it'll become kind of habit. Okay. And 90 days you can fulfill it. It becomes your lifestyle actually. You just keep doing it unconsciously. You don't make an effort for it.
Sir, మీరు ఇంతమందిని ట్రీట్ చేసి ఉంటారు, ఇంతమందిని మాతో మాట్లాడి ఉంటారు, చూసుంటారు కదా. టెల్ మీ వన్ మెడికల్ మిత్ యూ విష్ పీపుల్ న్యూ బిఫోర్.
మెడికల్ మిత్ ఏంటంటే దే ఫీల్ దట్ యువర్ డాక్టర్ విల్ హ్యావ్ ఆన్సర్స్ ఫర్ ఎవ్రీథింగ్. Sometimes we don't have answers, honestly speaking. I'm very honest with you.
Yeah.
We are also humans ultimately. Maybe little more read than the average person about the human body, but that's it. Because still we know just 10% more than you. 90% of the human body we still don't understand.
Correct.
Yeah.
That's great. డాక్టర్ పంజాతమా, మీరు ఇంత సూపర్గా మాట్లాడుతున్నారు కాబట్టి ఒక ర్యాపిడ్ కేర్ రౌండ్ పెట్టినా ఆన్సర్ ఇన్ ఎ వర్డ్ ఆర్ అ లైన్.
ఓకే,
సరేనా? ఓకే, దిస్ ఇస్ గోయింగ్ టు బి rapid care with the man himself. Okay, నేను రెడీ. rapid care with Dr. Guru Prasad. Here we go. Ready, sir?
Ready.
Rapid care with Dr. Guru Prasad.
Okay.
Mood set చేస్తున్నాను.
I'm already fired up for it.
One breakfast food you recommend to everyone. సద్దనం అంటే సద్దనం పెరుగు.
Yeah, that's right. Yeah.
సద్దనం పెరుగు ఉల్లిపాయ అదేంటి ఒకసారి చెప్పండి.
It's like rice, overnight cooked rice.
Correct.
దెన్ పెరుగు అంటే బేసిక్ గా
పాలు తోడేయడం
దాంట్లో. దెన్ స్మాల్ స్లైస్ ఆఫ్ మిర్చి అండ్ లిటిల్ ఆనియన్ అండ్ జస్ట్ సోక్ ఓవర్ నైట్.
అంతే.
దట్స్ ఇట్.
పొద్దున ఆవకాయ వేసుకొని తినొచ్చు.
ఆవకాయ ఎందుకు, మళ్ళీ సాల్ట్ అంతా.
ఓకే, ఉట్టి
తినాలి. అది కెన్ పుట్ సమ్ వాట్ యూ కాల్ దట్ తడకా అంటాం కదా. పుట్ దట్ ఇఫ్ యూ వాంట్ టు, బట్ నో ఆవకాయ.
ఓకే.
ఐ హోప్ యూ డోంట్ ఈట్ ఆవకాయ ఇన్ దట్. యూ డూ.
లైక్ దట్ mangoes problem for the lady.
Yeah.
Okay, problem.
Okay.
Most underrated daily health habit.
Sleep.
Gut or heart, which needs more attention in modern life?
Gut.
One supplement most people don't need but still take.
Actually, it's like there's a lot of thing about magnesium nowadays going on. People just keep popping magnesium. I don't know for what.
Okay, next one. Early to bed or early to rise, which is non-negotiable for you?
Early bed. Because if you sleep early in bed, you will rise early, right?
When do you sleep, sir?
Don't ask about that about me. But yeah, I mean, it's like, for me, actually, I sleep around 11 o'clock.
Sir, I sleep by 9:30 and wake up at 5:30, sir.
That's great. That's really healthy.
After 9 o'clock, my battery is down.
Oh, okay.
The one phrase you find yourself telling patients the most?
Stop Googling.
Tea or coffee, the healthier pick?
Healthier is coffee, but for me it's tea actually.
Which coffee, sir? Healthier one?
Black coffee is the healthiest because it's got health benefits, heart health, and also it prevents, they say, Alzheimer's. But again, yeah, I'm not a coffee person.
Which chai?
Me, I have a brand called Tea Box, which I order actually online.
Oh.
Which is like...
No, it is Irani or Adrak?
It's cardamom tea.
Oh,
Yeah.
done. Finally, your motto when it comes to health.
Be happy.
Be happy.
I think that's.
Let's be happy. Thank you so much.
Thank you. Bye-bye.
Thank you so much. Doctor.
Yeah,
Thank
yeah.
you.
Welcome.